Okay, the benefits of knee surgery are twofold, really. The main benefit of knee surgery is pain relief. So it's an operation that's done to improve pain after the initial recovery period is over. With pain relief, a lot of people find that their function also improves. So they're able to walk longer, they're able to do some activities that they weren't able to do before, like participating in sports and that sort of thing. So the main two benefits are pain relief and function. This is a very individual question. You will know that there is something wrong with your knee if you can't walk very well, if you're having to use a stick, or your walking is limited to just a few hundred yards. In addition to that, pain is a real indicator of when you might need a knee replacement. If you're getting regular pain, pain at rest, pain at night that bothers you at night, and pain that you're having to take regular painkillers for, or that it's difficult to control, then that's a time that you may need a knee replacement. I would certainly go and see your healthcare professional, your GP, or an orthopedic surgeon if you relate to one of these symptoms. It's generally a rough guide. It's definitely based on your individual tolerance for pain and your other activities and your functional level, but that's generally a rough guide for when you might need a knee replacement. Knee surgery is a painful operation, and it's painful for 2 months after the operation. The first 2 months are so sore that you feel that it wasn't worth doing the operation. But from 2 months after, people notice the benefits much more, and they feel that it was worth having the procedure. And the benefits continue to improve up to about 6 months to a year. And once they're at a steady state, they're there for the long term. The benefits do vary depending on patient. So if you're a very mobile patient, you may find that you get more function. If you're less mobile, then you'll benefit from the pain relief, but the function may not be significantly increased. However, joint replacements last for a very long time. So there is a national joint registry in the UK that monitors the outcome and revision rates of knee surgery, of knee replacements. So the results of the National Joint Registry show that the revision rate of most joint replacements is around 5%, somewhere between 3 to 10% at 10 years. So we can say that at 10 years, over 90% of joint replacements are still functioning. So knee surgery is a big operation, and as such carries with it some risk. There are some generic risks and some specific risks. So I would say that generic risks include things like bleeding and infection, but you will have a full set of blood tests to make sure your clotting is normal and that you're fit to have the operation beforehand, so that the risk of bleeding is minimized. I also personally use a tourniquet, so the risk of bleeding is also further minimized. As for infection is a big deal if you get it. However, those risks are severely minimized, significantly minimized, by one, giving you antibiotics before and after the operation, and two, making sure you are tested for any resistant microbes on your skin. So you'll have swabs before the operation to make sure you're as fit and healthy to have the operation as you possibly can. Other risks of the operation include things like stiffness, for which you might need some rehabilitation. The wounds can take a while to heal, and in particular with the scars around for a knee replacement, they're right at the front of the knee, which then can make kneeling quite difficult. Most people can return to kneeling if they absolutely want to, but they just need to train themselves by wearing knee pads for a period of time. Other risks of surgery include things like fractures around the implant or developing a blood clot. The risk of that is also reduced by giving you some blood thinners around the time of the operation for 2 weeks after the operation, according to our normal guidelines. So these are the general risks of having the procedure. However, I would say that the risk of something going wrong is very small, a less than 5% combined risk of something of one of these complications occurring. So the majority of patients is a very straightforward operation. Things that can increase the risk of complications are are conditions that are already present. So something like diabetes can increase the risk of infection. And what we would do is make sure that your diabetes is well controlled. Certainly would give antibiotics to everyone undergoing the operation, just as a precaution. There are lots of other conditions that can also increase the risk of bleeding or fractures around the knee. These conditions are all discussed before the operation, and if there are any reversible, treatable factors, then certainly that would be treated before the operation. So, for example, for bleeding disorders, you'd be given coagulation factors, and just to minimize the risk of bleeding during the operation. So all these steps are taken to minimize those risks. Knee replacement is a fantastic operation, and the majority of patients are delighted by the procedure. It can change people's lives. It can allow them to engage with their family members by engaging with social activities like walking or gentle exercise. So 80% of patients are completely delighted. In about 1 in 4 patients, or 20% of patients, they have some sort of issue with the knee replacement, and these are simple things like it could be a bit stiff, or it can move a little bit funny, or it can have some clicking or occasional discomfort. Even in that group of patients, they're better off than they were before the operation. It's just not perfect. It's important to remember that it's a prosthetic joint after all, and it may not be a completely perfect joint, but the aim is to improve things. So I would say the majority of patients are delighted with their operation. In terms of limitations, there are no restrictions that I would put on the patient after the surgery. However, it is a painful operation, and you should exercise patience really afterwards, because it is painful for 2 months, and there's no rushing that really. If you do too much in the early phases, you'll feel the pain and swelling the day after. So if I see patients in that situation, I would ask them to slow down a little bit. But nevertheless, you will be guided by a physiotherapist during the recovery period, so you don't need to worry about that. Specific to driving, most patients can return to driving when they can make an emergency stop safely, and after knee replacement, the general guideline is around 6 weeks after the surgery. However, this is very individual, and some people may return to driving sooner and some a bit later, but 6 weeks is a rough guide.